What distinguishes the work the body workers, healers, doctors, coaches, therapists of all sorts do from, say, what a computer programmer, an electrician, your barista, or a pilot might do, is something that we will call direct contact. Body workers, coaches, healers come into direct contact constantly with our client's energy. Physical energy is one thing. Emotional energy is another, and it's the emotional, mental sort of energy that we're going to focus most on this piece. You see, emotions and thoughts are certainly a type of energy. Not unlike molecules of air, this sort of energy may seem intangible because you can't always see it unless it's joined with something else like smoke or action. However, as intangible as emotional energy feels, it is physical. You have experienced the energy of another person's emotions or thoughts, so you know this is true. When we work in close contact with individuals, as we do over a period of time, it requires of us a deeper savvy and an understanding of a few elements of human dynamics so that we can keep our practices clean, clear, and healthy. The first dynamic we're going to discuss is that of transference. You see, by human nature, we often transfer energy through our thoughts and feelings without even thinking about it. For instance, you have transferred thoughts and feelings that you picked up from your parents to your current partner or to your children. Look at your own life and you'll see that. You see, for example, maybe we mistrust another individual because they look like somebody who harmed us or earned our mistrust. Maybe we adorn someone else with an unearned feeling of respect or regard because they resemble someone we know and love. Every person experiences a level of transference, and what we have to be on the watch for are the times when transference turns into an unhealthy situation. Because as warm and supportive and kind people in the helping fields as we are, we might come in contact with someone who has an unmet need from their childhood or a wounding, and they begin to see us as wonderful beyond belief. Sometimes our patients or clients become overly attached to us because they're transferring their need for love and connection to us as an object of someone who is warm and good, who touches them through their work, either physically, emotionally, or mentally, and yet they may not realize that this attachment is an over-attachment, a transference, and not an appropriate bond. These harmful or potentially harmful sorts of dynamics can occur in anyone who has an unmet emotional need.
Transference and countertransference was central to my work, and with her and with my patients. They would elicit attraction in me, in their transference, and I would experience that attraction with them. We worked very brutally and very honestly with these things, but the brutality and the fact that we could call a spade when there was sexual attraction between us took away the potency of it, so it was never acted upon.
So Sigmund Freud, are you saying that you also were attracted to your women patients?
I was attracted to them and I dreamt about them.
Did you dream about them?
Absolutely.
Did you dream that you had sex with them?
Absolutely. That was part
That's
of...
a no-no in my book.
But,
Dr. Michael Mantell is a nationally known psychologist. For 15 years, he served as a media psychologist on ABC's Good Morning America, and from 1980 to 1990, served as the chief psychologist for the San Diego Police Department. He's appeared on 10 News on numerous occasions as a mental health expert. Now this, a 16-page accusation against Dr. Mantell, a married man, filed by the executive officer of the state's Board of Psychology. It involves a woman who first sought treatment from Mantell in 2003. Then in 2010, she returned as a patient, this time for counseling from Dr. Mantell with her fiancé regarding infidelity and trust issues. According to the accusation, Dr. Mantell became sexually attracted to the woman and she broke off the engagement, continued counseling, then quit. Then 2 weeks later, a sexual and romantic relationship with Dr. Mantell ensued that would last about 4 months, during which time the accusation states the two would have sex several times per week in both her home and Dr. Mantell's office. The accusation states that the former fiance learned of the relationship and alerted his then therapist. The accusation states that Dr. Mantell and the woman then came up with a story in case they were ever questioned, and that Dr. Mantell told her to just deny, and said he could lose his license and go to prison as a result of his relationship with her, that he violated the 2-year rule. The accusation goes on to state that several months later, while being interviewed by a medical board investigator under oath, Dr. Mantell provided false sworn testimony and falsely denied ever having an intimate or sexual relationship with anyone he has ever treated.
According to the American Counselors Association, sexual or romantic relationships with former clients, current clients, or their family members are prohibited. Counselors are also prohibited from engaging in counseling with those they have previously had relationships with. Sexual or romantic relationships with current supervisees, counselor educators with students enrolled in the program, or research participants are also prohibited. Social relationships are formed for the purpose of friendship and enjoyment. Mutual needs are met during social interaction. Friends often give advice. They may lend money and help with finding a mate or a job. Other social relationships are more superficial. However, in all social relationships, there is little reflection on the effectiveness of the interaction. Intimate relationships are based on an emotional commitment. They are formed to fulfill multiple needs such as procreation, sexual and emotional satisfaction, economic security, social belonging, and to reduce loneliness. Most often the relationship is a partnership in which each member cares about the other's needs for growth and satisfaction. The therapeutic relationship differs from social and intimate relationships in that the counselor employs psychological theories, understanding of human development and behavior, and personal strengths to enhance the client's growth. The relationship is constantly focused on the client's needs. Boundaries and focus of the therapeutic relationship are clear. When a counselor begins to want the client to like them, the needs of the client cannot be adequately met, and the interaction can be detrimental to the client. So what can you do to minimize the risk of a dual relationship? Use informed consent to discuss issues surrounding the dual relationship. Talk with clients about any potential conflicts that may arise, and maintain healthy boundaries. Here are some useful guidelines and suggestions to help determine the best response to sexual behavior. Each situation will depend on the severity and type of behavior. Be self-aware. If necessary, talk about your feelings with peers, supervisors, or counselors. Provide feedback to the person acting inappropriately in an assertive, non-threatening manner. State clearly what behavior is unacceptable. Set limits by telling the client the consequences of the behavior. In dealing with a flirtatious patient, honesty is the best policy. If a patient wants to have a personal relationship with you, it's best to explain clearly that the relationship is unethical, unprofessional, or even illegal, and that you would never consider it. This helps to depersonalize the issue. Be clear. If you suspect the client has sexual preoccupations, or if your treatment might be misconstrued for any reason, it is very important to protect yourself. Make sure the patient understands the procedures and the reasons for them. If the patient is unable to understand or responds inappropriately in any way, you should immediately report the behavior.
I'm Ron Zimmett, a trial lawyer for over 35 years, and I'm Negley Associates Risk Management Consultant. I've had the honor of representing the Mental Health Risk Retention Group as their general counsel for over 20 years, and I have a great deal of experience defending mental health care providers such as yourself. I also provide on-site risk management review and training for staff at mental health centers throughout the country. Our first topic is the biggest mistake you can make in mental health care that will guarantee a lawsuit and how to avoid it. So, what's the biggest mistake? I suspect that many of you can guess. Simply stated, if you have sex of any kind with a center patient, you can expect a lawsuit and probably criminal charges. This includes former patients as well as current patients. It is not limited just to counselors, but to any mental health center staff or mental health care provider. Some of you may be thinking as you listen, there's no way you'd have sex with a patient, so you don't have to listen any further. Our experience, however, with many lawsuits in this area indicates that it may not be as easy as you think to avoid having sex with a patient. In fact, it is clear that people who know better and have the best of intentions can and do give in to temptation. For example, in one of our claims, a psychologist with a 30-year tenure at a community mental health center as director of the clinical psychology department and with a spotless record of positive performance reviews had sex with a patient many times in his mental health center office. Strikingly, the psychologist also was a member of the State Board of Psychological Examiners and was responsible for disciplining psychologists who had sexual relations with their clients. What could possibly have happened to a man like this to allow him to justify having sex with a patient at his office, no less? Asking it another way, what could possibly happen to you to allow you to justify having sex with a patient? Certainly you know it's wrong and that it's a clear boundary violation. Certainly you know you could be fired and charged with a criminal violation for which you could go to jail. Our claims history, though, makes it clear that when people like this have sex with patients, they have almost always been experiencing some type of upheaval in their lives that makes them more vulnerable to giving in to temptation and that makes them want to seek the comfort of false love from a patient. There are almost always warning signs of the impending boundary violation. This is something you should be aware of so that you can seek help to keep you from taking advantage of a client, and supervisors should be aware of to counsel their employees to get the help they need rather than hurting somebody. The warning signs are basically common sense. Ask yourself, what would make me vulnerable to temptation? Here are some of the signs. Have you had a severe illness or death in the family? Have you gone through a difficult divorce? Are you having difficulty with drugs or alcohol? Are you suffering from depression, social withdrawal, or low energy? Are you suffering from increased anxiety? Are you overly sensitive to criticism? Have you been having anger control problems? Have you become preoccupied with thoughts about sexual issues? Have you socialized with a client in a setting that is not part of a social event in a treatment program? Are you physically attracted to a particular client? So these are just some of the warning signs you and supervisors should be thinking about. Of course, I don't mean that everybody who has these kinds of warning signs has sex with a patient. Just that people who do have sex with patients almost always have these warning signs. Therefore, if you notice yourself having some of these problems, talk to your supervisor and get the help you need. Just so you don't forget, the psychologist I referred to earlier was fired from his job, was charged with a crime, and lost his license. It simply is not worth it.